Are you ready? I'm going to start this.
Yeah, it's already going.
It's going, okay. Okay. So Mike, tell us why medical practices, primary care practices, should embrace social media and not be afraid.
Why practices should embrace social media? Well, I get this question a lot, as you can imagine, and what I tell people is patients are using the internet and social media already. There's some data out there from the Pew Research Center, which says about 58% of adults have looked online for health information in the past year. And also, about 35% have tried to diagnose themselves using the internet. So I tell providers and physicians and clinics that patients are already using this out there, and I think that practices should embrace it because, but there's also been some data out there that 90% of what's on Wikipedia is wrong. So I think this is a great opportunity for clinicians and providers and practices to be proactive in utilizing and knowing about social media because patients are going to ask them about it.
So it sounds like there's almost a responsibility of practices to be on social media to kind of counter some of the less accurate info that's out there.
Yeah, exactly. And when people ask me, what do I use social media for? I don't use social media for any kind of patient care at all. The only way I would recommend that is if you're behind kind of like an email that is protected. There's a lot of patient portals that do that now. But I don't Facebook with my patients. I don't use Twitter with my patients to do patient care. What I use social media for is mainly for patient education. And another thing that I use it for is to dispel myths. I still have parents that come in that tell me that they believe that vaccines still cause autism, and that's an opportunity for me to kind of engage them with that and say, what's correct on the internet, what's bad on the internet. But what I use a lot more social media for is for advocacy, and I use it to, show, what patients are doing with this. Patients are being advocates for themselves. They're telling their stories online. They are gathering as a community with patients who have the same disease state, and for them to know that they're not the only person out there with that diagnosis. The other thing that I really emphasize to clinicians and providers in clinics about using social media is using it for social media reputation, what I call the social media footprint. When you Google your clinic or your provider or your clinician, what really comes up? And for a lot of providers, it is kind of these health rating sites. But providers can use social media to sign up for something like LinkedIn and to have their right and correct professional information out there. So those are the main things that I use social media for and that I recommend clinics and providers and clinicians using social media.
So you mentioned advocacy. Can you sort of give me an example of how you use social media or what you advocate through social media, how that works for you?
Well, an example that I use is an organization called Primary Care Progress, and they're out of the Boston area, and obviously, as their name says, they're advocates for primary care. And what they did a couple of years ago was kind of a photo campaign to raise the awareness of the value of primary care. Primary care means to me, or there's a powerful photo of an elderly lady in her 90s, and she's holding up a sign that says, "Primary care got me this far." And it is those type of awareness type of campaigns, raising the awareness on the internet for advocacy's sake. I'm part of the American Academy of Family Physicians. In our organization, we do a lot of legislative type of advocacy, talking about primary care, talking about family medicine, our value to the country, and how we can have different models out there like patient-centered medical home. There's a lot of people talking about direct care medicine, direct care primary medicine. And those are the things that me and our little group of people in family medicine, we call ourselves the Family Medicine Revolution. You can find us on Twitter at hashtag FM Revolution. And if you want to see what the cutting edge of what family physicians and what primary care physicians are doing, that's a community that I encourage people to kind of check out.
Okay, and can you expand on that a little bit about the community aspects of Twitter? I mean, you mentioned that last night about how you're kind of having an international conversation. So can you make the argument for the physician who may not, who's like, say, Twitter, I don't have time for that crap. What does it really do for you? I mean, what are you getting out of it?
Well, I usually utilize Twitter in 3 or 4 different ways. One is I use it to curate information. So if there's important information that I think that people would need to know about, I put that on my Twitter feed. Whether it could be something clinical from a clinical conference, it could be something legislative, it could be something in the news, it could be something silly, it could be something that I am interested in. The next main use that I have physicians try Twitter is at conferences like this, where they can ask questions, and they see all these people kind of using their smartphone and saying, "Oh, what are you guys doing?" And a lot of people are taking notes during the keynote talks. And what happens there is that you start to engage people who are not at the conference, outside the walls of the conference. And I have about 17,000 Twitter followers, and I've gotten those followers because they have seen the content that I have given them through conferences, through the articles I read. People also utilize Twitter for Twitter chats, which are kind of real-time conversations, kind of like texting, that are at designated times during the week, and that gets a worldwide audience. And that's not for everybody, but it is a worldwide conversation, a powerful way to do that. And the last way that I use Twitter is just for conversation. There have been clinicians, even at this conference, I've been tweeting out some things, and there was a physician in the Philippines who tweeted back to me and said, these are some great concepts about patient-centered care. This is stuff that we can kind of utilize here in my country. So that's what I tell physicians, is that you can have a conference that is virtually worldwide. You can have conversations that are worldwide. There are some technicalities that you need to learn. It is kind of overwhelming when you first start it, but if you're at a conference when people are tweeting, you can ask questions, and it's actually a fun time doing it.
So where can someone get sort of the basics of tweeting? There's not really a site you can go to that says, here's how to use hashtags, or is there?
Well, I mean, there are, but I mean, what I found especially with physicians and clinicians, it's usually kind of hands-on type of thing. You can tell them to go to this site or that site. They're really not going to do that. So that's why I think that conferences are our best way to kind of take advantage of that. When I'm talking to practices and clinics and things, and talking about social media, I tell them that social media is not another checkbox that you have to do. It's kind of an extension of your current communication plan. So if you're traditionally using things like newsletters and that type of thing, look for opportunities how you can add Facebook, because most patients that I've seen are on Facebook. When I go into the exam room, patients are looking at their phone, checking their Facebook page. What if you had a resource on there from your clinic saying, our flu shots are in? And that would be something very helpful for patients. Or if there is like a meningitis outbreak in your community, your clinic can be really at the forefront and saying, this is information about meningitis. So kind of use that as an extension of your current communication plan. Ask yourself, what is the message that you want to put out there? Who is the audience? Basic type of communication type of things. But you really need to find a social media champion in the clinic. Everybody says it's usually younger people, and it is, or it's usually the children of a staff member. They can really give you an insight on what that is. And just make it fun. People put up, photos, if they're at an outreach event, if they're volunteering at at a soup kitchen or something like that, or even if they're having a fun social event like a softball game or something like that. It shows that the clinic is part of the community. And I think that's the real value of social media for clinics. And I think they should really think about it because it's not a burden. It does take some time, but it is a lot of fun when you really get it going.
That's great. Anything you want to add?
No, I mean, it's great being at this conference. People can find me at drmikesavilla.com, and I'm happy to help with anybody as they get started. It can be a very encompassing, it can be a very overwhelming type of task, but there are a lot of people out there who can help you, who've been through this before, and I'd be happy to help anybody out.
And your Twitter handle is?
At Dr. Mike Savilla.
Right, okay. Is there a period after doctor?
No, there isn't.
Yeah, okay. All right. Good, thanks.
Thank you.
Whoops. All right.
That sound okay?
Sounded great.
Okay, great.
Yeah.